Hi, everyone. This is Invisible Reality again. We're here today with two nurse practitioners, Amy and Garner. I'm not going to talk about you guys. I just want every one of you say briefly describe her role and what she does in the current career.
Okay, I'll start. So my name's Amy Bryant. I have been a nurse practitioner since, I guess, I don't know, 2017, however many years that has been. And I've been in one clinic working with Dr. Ron, who does like functional medicine, is what we started out as. Now we're doing more lifestyle focus. It's, you know, rational medicine is kind of how I think of it. Where I have ended up in these last 7 years, 6 years, has been working with a complex chronic condition population of people that are more like medical misfits and don't really fit in the conventional medicine world. They are young patients that have something called Ehlers-Danlos syndrome. And with Do you have a question?
No, I'm one of those patients.
Oh, yes, you're about to meet
Yeah.
the patient.
Yeah.
Well, and with that comes a lot of problems with the nervous system, with the GI system, the immune system, autoimmune conditions. There's just a slew of things that kind of go along with that. And the reason it has become kind of a niche for me is, you have to approach these people in like a holistic way. So there's no guidelines for how to treat these people. So I have spent the last 7 years figuring it out. And that's kind of where I have ended up now.
Perfect. Awesome. So, what about you, Garner?
Well, my name is Gardner Mack. I am also a nurse practitioner, but I've only been practicing as an NP since August. So I finished my nursing school program and graduated in May of 2024. I actually did my last rotation of NP school here in this clinic in the Texas Center for Lifestyle Medicine. I'm so grateful that they invited me on the team. Before that, I was a nurse, a floor nurse at the pediatric ICU at Texas Children's Hospital. Then I worked a little bit in the neurosensory department at Methodist Hospital. Then I went into school nursing and then decided I needed to make a life change and do something else. So then I came in here, or I went back to school, and then I landed here. But in our clinic, I'm kind of trying to figure out my niche, but I do everything. All new patients, wellness, metabolic visits, all the new patients for Amy.
Yeah, Garner was thrown into the deep end for sure.
Okay.
But it's been a rewarding learning experience, I will say.
That's great. So, congratulations on your graduation and your new role.
Thank you.
A question to Amy. So, what was your typical documentation way when you first practiced nursing?
It was a mess. What it was. We, basically had to listen and type at the same time. So for a new nurse practitioner, that is not an easy thing because your mind is constantly trying to pull up knowledge
Mhm.
to be useful in that visit. So it was a lot of shorthand for me at first. So I would just like jot down a couple of notes on what we were talking about. And later that night, after working 8 hours in the clinic, I pretty much spent 4 hours every night trying to consolidate and remember these stories that I got from, eight different patients during the day. So I would venture to say that was probably one of the most stressful things to adapt to going from bedside nursing, where you just kind of check the box to having to remember stories and what
So,
you're going to do about it. So you also, in addition to that, you had to remember what orders you were going to put in and what diagnosis codes and all that stuff.
what would you say? How much time did you spend on charting or like documenting a day?
I mean, at least 4 hours at night. And that was after the documentation
Work.
that I did during the day.
Okay.
So, I mean, it was 4 to 6 hours, I would say.
So what were your biggest challenges while documenting?
Trying to get the story right
Mhm.
and, being able to actively listen to someone's health story and make meaningful assumptions and decisions based on what they were telling me while I was also trying to type and write down the correct things. And yeah, I mean, and then by the time you were done with the visit, you were expected to have a plan.
Yes, that's
So,
true.
you're typing, you're taking in stuff, you're consolidating it, and you're also coming up with something that you're going to do all at the same time. A lot of multitasking.
So Gardner, did you work and document manually before or
Yeah.
okay.
The first time I ever used AI was here, actually.
So do you say your experience was like
Without it,
without it and then with it?
very similar to Amy. And I would find myself missing sometimes important pieces because, I was so focused on finishing a thought for one situation or one problem or complaint or whatever that the patient would be still talking and I couldn't recall or I just couldn't handle it. It was almost like an overload. But with AI, I've noticed that I can have a more complete picture of the patient. My notes are much more thorough,
Right.
although much longer, which is fine. But like Amy was saying, I can have a conversation and look at the patient in the eyes. And I get a lot of really nice feedback that I'm glad you're listening because I think, it's unique because when you go somewhere and they are just typing and not looking at you, looking at the screen the whole time. It's it's disconcerting as a patient, right? And so you're thinking on that side because I've experienced that oh, they're not listening, they don't really care about what's going on with me. Where the reality, we know the reality, and the reality is we're trying to get it all in so we don't forget. But the benefit of AI is it takes that out of it, and we can actually have a human relationship with our patient.
So when would you say the AI was introduced to your practice?
It was before Gardner got there. Let's see, 2022. Yeah, probably 2 years ago. Uh,
That's considered early compared to other practices, right?
yes, and, we tried multiple different platforms, and honestly, I am resistant to change. That is just my personality. And the first platform that we used, I hated it. I actually told them not to pay for me to have a subscription because they would get the grammar wrong and they would get the story wrong most of the time. And it was so cumbersome. And, other providers in the clinic made do with it, but I refused to do it. So I just kept to my overwhelmed ways until we found this new AI company called Ambience. And this has been so much better. And maybe that's because AI has had some time to
Mhm.
mature and get better, but it's very intuitive. It will learn your style of conversation and you have an opportunity to edit things afterwards, and once you've started editing things over and over again, it kind of picks up on that, and then there's few like I barely even have to do any changes to my notes anymore. So it has, in the last couple of years, has completely changed my stress level at work and my ability. I can get things done by 5 o'clock
Mhm.
and be done with it, which
Yeah, so you don't take it back home
I
with you.
don't. Yes, which is so important.
So this question is for both of you. What were your initial reaction when the idea of using AI scribes introduced to you in your clinic, in your practice?
I said no. I honestly, it freaked me out. I mean, Dr. Ron is a very forward thinker. And for someone like me who, likes things to
I'm very
make
classic.
sense,
Yes. Yeah.
and, he's throwing this robot thing at us and saying this is the future of medicine and
Mhm.
all this stuff. And I said, no, I don't want to do it. And then we got that first program that was terrible. And I further just was very resistant to it. But
So what about you?
I thought it was super cool, but I had also done my last rotation of NP school with Dr. Ron and had seen him use it. Well, Dr. Ron, Amy, Michelle, I'd seen everyone use it. And I was like, oh my goodness, because at that point I was still hand documenting everything, including all my schoolwork, which took hours. I mean, I would have
Yeah.
to wake up early, go to bed late, work on the weekends. It was just nuts. But I was like, golly, this really eliminates having to do this at home. And I was excited to start using it. It was a big learning curve when I first started to use it, but I don't think I could do what I do now without it.
I think when looking back, when I was at school, I used to record and then go back home and write things because the thing is, I tried so many years to focus and I just lose attention. Like I can't focus on someone talking and like writing. So I think it's a big blessing for people like me. I didn't try it yet, but I'm very encouraged to do it.
You haven't tried the AI yet?
Scribe, like,
The
no, I
Scribe?
tried the AI and
Okay,
other things, yeah, but
okay.
if not,
Use it, like, to scribe.
yeah, yes.
Yeah.
So another question that comes to my mind, how has the AI Scribe changed your daily routine if you look back?
It's given me my life back. I mean, whenever I first started as a nurse practitioner, I was single. I didn't have any, like, huge obligations, and I could feasibly spend a lot of time after work
Mhm,
working.
mhm.
And at that time, and I think, I don't know, there's this huge jump from going from a bedside nurse to a provider, and then all of a sudden you you almost wanna martyr yourself and feel like I'm working all the time, I'm accomplishing this, I'm doing this, and so I didn't question it at the time. I was stressed, but I didn't question it until I wanted to become a mom, and,
Mhm,
thankfully, Dr. Ron had the foresight to know how much
mhm.
I was struggling, and he was really on me to force me into the AI world, and it was right whenever I got pregnant was when he got this ambient company came along.
Oh, that's great.
Yeah, I mean,
Good timing.
timing, perfect timing because I had the 9 months to get with the program on the ambience, and honestly, I don't think I would be able to be the mom that I am
Mhm.
the way that I used to work. I
Yes, I
would not
agree.
have been able to do it. It would have been either sacrificing time with my kid or
Or
sacrificing
second.
sleep,
That's true.
and now I don't have to do either.
Mm. That's one of the biggest advantage that AI gave us. I always think of some people are scared of AI, but
Mhm.
I'm like, if you use it, everything has benefits, and if you use it right, it's gonna help you.
Yep, exactly.
I
You have to not be scared to use it.
yes, to make a change.
Scared of the unknown. Yeah.
Yeah. So, what about you, Gardner?
I think very much the same about what Amy said too. Yeah, I mean, since I'm a newbie,
Mhm.
it's taken a minute to get a routine, but I think using AI has helped so much. And then again, like I said earlier, I'm just grateful because trying to figure out all the pieces of my job and these complex patients and, all of the things that go into that. AI has really been a huge help because I just don't think that these patients would get the same care, honestly.
That's great. So, what is the biggest difference in your patient's reactions now compared to before to AI?
So before, I think there was always a lot of back and forth on the patient being like, "You said this last time," and I'm like,
Mhm,
"I don't remember that. I didn't write that down, so I don't know." But
mhm.
now we have better communication because these patients, they'll get a note the same day because I can finish the notes the same day, not a week later. So they have reference to look back at our conversation. I have reference to look back at our conversation. And, there's less that is missed or misconstrued because it is in black and white, our conversation that we had. So I think communication, treatment plans are much better conveyed now. So, it's a lot more efficient with patient care and communication.
So Garner, you recently graduated, but you were practicing before as a nurse, right?
The nurse.
Did that did is there is a difference in patients like reaction between documentation and AI scribe?
So my previous employers, it was either hospital or clinic or, something like that. So, or in the school setting, the documentation is very different and AI was never even a thought. So when I got into this realm, like I say, it was a learning curve, but I'm so grateful because it's just allowed me to explore so many more options and create relationships with my patients. I don't think I could have had the old way.
Mhm.
Mhm.
And has AI affected the number of patients you can see a day?
Yes. Yeah. I mean, I definitely think that I can handle a lot more than I used to.
Mhm.
With the complex patients that we have, it's not going to like dramatically increase that number. If I had just normal primary care patients, this AI, I could probably knock out like 30 patients. I mean, but just the type of patients that I see predominantly, I have increased probably my schedule from like 8 patients to 12. I can see 12 comfortably. So that's something.
Yeah, because I feel like if you're with complex cases, if you don't have AI, you might just see like what, six?
Yes.
Yeah, you
Yes.
know?
That was always yeah. Anything over 6 previously was too much, and it was
Yeah,
often over 6. So, yeah.
great. So another question, how would you compare the quality of AI generated notes to your previous notes?
Oh, it's much more robust. I mean, I sometimes I'll see a patient that's, like, coming to reestablish care, and I haven't seen them since, like, 2021, and I'll look at the note that I wrote at that point,
Mhm.
and it's just I mean, it's, like, very choppy, very like, you don't get the story. The AI creates a story, and, you have a more of an idea of where the patient's at that point, and, what your specific recommendations are and why. There's rationale. Whereas, like, my notes would be like, draw labs or,
Mhm.
go to PT. But now it's like, we're doing this for X, Y, and Z. So it's a lot more information now.
And what would you say about your quality of notes, Gardner?
Well, to be honest with you, I've never documented this thoroughly before.
Okay.
And
You can't.
you can't. You
It's
don't have the time.
that's the human
Yeah,
brain.
we have
Yeah,
limitations.
yeah. I mean, the other thing I love about it is not just how thorough it is, but through our AI system, we can actually, it will give you suggestion.
Mhm.
So, I mean, there are various things that maybe I didn't think about or the patient mentioned that I didn't bring up or whatever, but AI will incorporate that somehow and in the story, in the narrative. So that's really beneficial.
And do you guys find yourself editing your notes? I mean, the AI notes afterwards?
I did in the
Or
beginning a lot,
Mhm.
but like I said, it learns you.
Mhm.
So the edits that you make, it learns that, that's not quite right. So let's do it that way. So I'm to the point now where I just really skim over it. And sometimes I have to correct people's spelling of their names because it has trouble with that. But for the most part, it gets things pretty spot on.
Yeah.
Do
Same.
you? Yeah.
Same.
I skim through my notes. There are things I have to tweak here and there, but it's not like I have to rewrite an entire section.
Mhm. Yep.
So have you noticed any common errors or hallucinations, as we say, in the AI generated notes?
Early on, yes. Before Gardner got there,
Mhm.
we did have several problems with the hallucinations. You know what hallucinations are, Gardner?
I can only imagine.
It's basically where the AI just takes the story to a completely different place that, like, it did not happen. Nobody
Okay.
said it. It just shows up in the note, and you're like, "What is this?" But it was
Well,
happening in the beginning.
that has happened for me a couple times, maybe just because it doesn't realize. or it hasn't learned me yet, or I don't know.
Yes. Yeah.
Sometimes it will say, like, for instance, referred to neurology. Well, I never even talked about neurology in this appointment. So, I'll have to go in and take that out. But that's usually the extent of it.
Yeah. I think that's just like the robot program. It's programmed to know what you maybe would say. But the hallucination, when that happens, it's like the entire story is wrong.
Oh, yeah. Haven't had that happen.
And I think that because when Ambience first started with us, I think they were a fairly new company. So I think that also happened with their AI maturity or however that works.
I think it needs time to mature, as you said in the beginning. So how have the patients reacted to the use of AI during the consultation?
I think positively. I haven't had anybody not like it, especially whenever I explain to them, I can sit here and have a conversation with you without not looking at you. And you will have a detailed account of what we talk about. They all like that. So I haven't really had anyone have a problem with it.
So, as you mentioned before, that you can look at the patients in the eye. So, you think that it affected your relationship with the patients?
Absolutely. Absolutely. And, on the patient side, for sure. But even on my side, like there's so much nonverbal stuff you can get from a
Mhm.
patient if you're just watching them as
Okay.
opposed to like focused in on your computer and just listening to them. So, now I feel like I am much more empathetic and able to kind of steer the conversation if I'm seeing the patient visibly get anxious or upset or tear up. There's I think much better empathetic communication going on now that I can watch the patient. And I know on the patient side, just being a human, having someone look me in the eyes and actually like show concern over what I'm talking
Yes.
about, I think would also improve how much information you're getting from the patient or wanting to give to the provider.
I don't know if I'm describing it right, but it increases the intimate relationship between the provider and the patients,
And
right?
the being comfortable enough and feeling safe
That
enough in that environment to really get because honestly, and I said this in the beginning, even before AI, and this was more when we were functional medicine focused and trying to give patients more time, you are not you're only as good as the information that you get as a provider. And if you're quickly trying to just extract the important details and focused on your charting and focused on your orders, you're not going to take care of that patient the way that they should be taken care of. And I think that most people in the medical system are so used to this relationship that it's okay. Nobody questions it. But this new way of charting, a new way of being able to communicate with the patient, I think is going to raise the bar on a lot of that and improve the way that we are able to extract, health problems out of our patients' stories. Because sometimes it's buried. The lead is
right.
always buried and it takes 20, 30 minutes to get it out of them sometimes.
That's true. So, Garner, do you think it's affected your relationship positively or negatively?
Oh, definitely positively. Yeah, and to piggyback on what Amy was saying, I mean, I agree 1,000%. And sometimes I'll have a new patient say, and they're talking and talking and talking, but nothing comes out until about the 35, 40-minute mark. They're just
Yeah.
talking. And so once I'm sitting there listening and responding and, interacting with them, then they become comfortable and they take that guard down and they're like, all right, this is the time here.
And have you ever had any patient that express security concerns or data concerns
No,
when coming to AI Scribe? Because many people don't like the privacy intruders of, yeah, yeah. So you have never faced anything like that?
no.
That's great.
Surprisingly, I mean, our patient population, they're very well informed, so I'm surprised that we haven't, but no, most people are okay with it.
Yeah, I haven't had any either.
How many hours would you think, or like how much time would you think that AI saves you a day? AI Scribe, if we come to hours.
6 hours.
Oh, wow. What about you?
Yeah, I would say the same. I mean, well, I don't see as many patients yet as Amy, but on crazy days, yes. So yeah,
Um,
4 to 6 hours probably,
oh,
which is a considerable amount of time.
Mhm.
yes, yes. Yeah. Well, 6 hours. You can travel in 6 hours. Like there are
The whole
just
life.
add
6 hours.
yeah, add 2 hours and you'll be in like Europe. And what do you do with the extra time you gained?
Spend it with my family.
Same. Spend it with my kids.
That's awesome. That's awesome. Has the AI Scribe affected your work-life balance?
Yes. Yes. I went from being obsessed with work and thinking about work and thinking I had to do something to now, at 5 o'clock, I go get my son and we play until bedtime.
Yeah.
And, I'm not saying I'm perfect now. I still occasionally do have to finish charts in the evening, but it's much less and it's
Okay.
much less of a taxing thing because usually it's just about pulling a note over and adding a couple of orders that I need to put in.
And you don't have the stress of like missing like a very important
Yeah.
information,
Like trying to
right?
remember the conversation. That was
Yeah.
always the biggest stress.
Yeah, I think that's one of the most relieving things for me too, especially as a new practitioner is like, all right, I don't have to be so worried that I didn't catch every detail. It's in there. I can come
Mhm.
back to it later if I need to. So,
Yes. I agree. I agree. I'm the worst person on like writing notes and listening, so I totally agree. Like AI would save my life if like I'm practicing. And so what are the some challenges you've encountered while using AI Scribe in your career?
When it goes out and doesn't work anymore. I
So
mean,
you have to go back to the
it's like
previous
you
method.
freeze and you're like, "How did I used to do this?"
Yeah.
It doesn't happen often, but it has happened where I've had to do a visit the way I used to do a visit, and it's not enjoyable.
yeah, that's only happened to me a couple times, but I just bang my head against the wall like, oh, this is going to take forever.
Excuse.
Yes.
Sorry. So, are there any situation where do you prefer not to use the AI scribe in your consultation or like encounter with patients?
Mm.
No, I
No.
never don't. I mean, I
Yeah.
every patient.
Even whenever I do phone calls and peer to peers, I'll even turn it on just so I don't miss anything.
And how do you ensure the accuracy of AI notes?
I look at them right after I'm done when the
Okay.
information is fresh. Yeah. I mean, that's the
And
only
I think once you use the same AI, it kind of learn your personality or like learn you.
yeah.
That's what, yeah, Dr. Ron says. So
Yeah, it's a that
then the accuracy will be, it's going to be more accurate, I mean.
and that's been very true over the last couple of years.
Has the AI scribe influenced how you approach diagnosis or treatment plan? Like, would it like suggest something that didn't come to your mind or like didn't cross your mind and you're like, "Oh yeah, that's true."
Yes, I think the best way I can say that has helped is, like, with the diagnosis populate because once you push your note over, it gives you diagnosis suggestions,
Mhm.
and there's sometimes, especially with these,
Mhm.
complex medical cases where there's not, like, a specific, "This is the problem,"
Yeah.
gives me the suggestion, I'll be like, "Oh, that's how I should say that." So, whereas I'm not sure, I would always know exactly what diagnosis code to put for the problem that we had talked about. So it has
And
saved me on several occasions on that.
what about you, Gardner?
Yeah, I would say the same thing. Also, sometimes too, with suggestions for following through with treatment or, whatever the case may be, it gives, it gives little hints, really suggestions, I guess, and you can take them or leave them. But I think it's, always good because we're able to individualize our care plans that way.
Yeah. So I'm thinking of like having a Wikipedia with you that interacts with you in the same visit. That's how AI suggests things, I mean. And then you take it or leave it, as you said. Like if it suggests like a lab order or something that didn't cross your mind, actually, especially with complex cases. Because many of those complex cases, as you said, they don't have guidelines and they are not a typical case.
Yeah,
I'm
not
very happy with AI Scribe.
yeah.
Yeah.
That, and I know Gardner uses Perplexity a lot. That's a whole other AI entity that kind of does what you're saying, and I use that a lot now, and I didn't even think about using it until actually Gardner started. Her notes were all about, you know, I think you used Perplexity a lot, or Dr. Ron said that you did.
Markets for it a lot. I'm like, do
Yeah,
you have
exactly.
fears there? Yeah,
But
I use it a lot
yeah,
too.
and I've started using it for, like, lab values that don't make sense to me or symptoms that sound like something might be going on, but I don't know what it is. You put it into this Perplexity, and you get a very evidence-based list
Yeah.
and a leg to stand on, like, you have somewhere to go with. So, I feel like not I'm not speaking for Gardner, but, like, watching her and knowing where I started with all of this, I mean, it's night and day. I had no idea what I was seeing. I learned from my patients. They were my teachers, and that's the only way I, like, picked up on things, and, I mean, it took 5 years to
Mhm.
figure it out on most of this stuff, and, I feel like Gardner is starting in a good place where she has this kind of resource to already have that formulation kind of set in place.
So, would you say that AI Scribe improved your decision making and diagnosis, or like at the clinic?
Yes.
Oh, definitely. Yeah. And for me, it's helped me with confidence. Like, oh, I thought it was this, but I wasn't for sure. But oh, okay. Yes, this is what it is, you know?
Yeah, because it's evidence based
Yeah,
too.
it's all
Exactly.
evidence.
So
Yeah.
it's coming from somewhere solid,
Yes.
and yeah, I mean, again, like, the jump from being a nurse to being a nurse practitioner, the difference is you
Mhm.
got nowhere to fall back on. It's
Yes.
you and the patient, and you've gotta come up with a problem that might be happening, a diagnosis that might be happening, and this kind of takes the place of having to run and go ask the doctor all the time.
It feels like you have a huge responsibility.
Mhm. Yeah, and there's a fair amount of imposter syndrome that happens,
Yeah.
so you second guess yourself, and this
Yeah.
little AI guy is there to tell you you're on the right track.
That's cool. So, how do you say that AI Scribe would be evolving in the next 10 years? Let's say 10 years. Yeah.
I think that patients are gonna start using it a lot more and,
Mm.
diagnosing themselves, not that they already don't with, like, Google, but it's gonna be
Oh
more
my God.
accurate.
Yes.
Gonna be something, and this is always kind of where I like to go with my patients, let them know that it's a partnership, it's not me dictating what's going on with their health. I like it whenever patients come to me with, like, "Is this a problem that I might be having?" 'Cause it gives me an idea, but I think patients are gonna start becoming more savvy with this kinda stuff, and it's gonna be less about the doctor and the provider telling them what might be the problem, and more about, "Okay, this might be the problem that you're bringing to me, and let's talk about how to fix it."
What about you, Gardner?
Yeah, I think in the next 5 to 10 years, I think we'll see it in many more clinics, or at least I hope. Hoping too that it will implement in hospitals as well, because I think that would be huge, especially when it comes to life saving situations, and, residents, medical students, the whole thing. Um, but I don't see it as a bad thing. I don't see it as a scary thing. It's such a resource, and everything I look up, even Perplexity, Ambience, all the things, they are, like Amy was saying, they're evidence-based, and I don't have to go to the library for 45 hours or whatever and thumb through articles and try to figure out what's the most evidence-based right. So it just is kind of there for you already, and I just can't imagine a better resource, and I can only see it proliferating from here, to be honest.
Do you see AI technology in other areas in healthcare in the future?
In the future, yes. I mean, now things are slowly implementing. I'm actually seeing it at pharmacies, which is cool.
Mhm.
It's slow. I think people are trying to adopt the idea, but I
Yeah.
think it will become more prevalent as we move forward.
Do you have any concerns about increasing role of AI in healthcare, or would you think it's an advantage if it's increased, like if they're all increased?
I mean, I think that if it's used appropriately, I'm not concerned about it. What I would be concerned, I think that AI shouldn't take the place of your critical thinking skills and your humanness of providing care. So far I've talked about how it increases my humanness in providing care, but it could also be the opposite. It could also, you know, be someone that is so stuck in the AI world that they're not looking at what's happening in front of them.
You mean it depends on the users?
It depends on the user. I mean, yeah, you can't completely is that a word? Automate everything, and there's always gonna be the human difference here. So,
So what about you, Gardner?
I hadn't thought about it from that perspective, to be honest, where people kind of transition to the other way. But that's interesting. I mean, I can see it. I mean, the only way right now as a new practitioner and learning and figuring out, I can only see it as a helpful tool. And it is.
Yes.
It is so helpful. And it's not a crutch. I don't want to make any mistake there. It's definitely not a crutch. That it's so beneficial and it's time saving. And like we were talking earlier, you're allowed this. I feel like it gives you the freedom to have um, relationships with your patients where otherwise I don't, you can't because of, note taking.
It reminded me like when the internet was like famous at first, and then people were against it. Some people, and I was like, it depends on how you use it. You
exactly.
can, yeah. So I think it's the same thing. For like the last few questions, I want to ask if you would give any advice for other nurse practitioners who are considering using AI scribes.
Do it.
Yeah.
Do it.
Part of
Do
it.
it. Just jump in, learn it, do it, use it every day. And I think you'll become so much more familiar that way.
And another question, I mean, are there any best practices you've developed for working with AI scribe?
I don't know. I would say if I were being perfect at best practices, it would be to completely close out my note before I move on to the next one, because that is possible. I think my anxiety sometimes gets in the way of that happening, but best practices would definitely be record your note, skim your note, edit it, close it, move it over into the chart, have it be done.
And what about you, Gardner?
Yeah, I'm kind of thinking along the same train as Amy. Yeah, it's hard to do that because I think most NPs are type A. And so we've got to go back and review, make sure all the I's are dotted, the T's are crossed. And but best practice, like she said, would be to just finish it up, close it, and move on.
Mhm.
So before we end this cast, so overall, you feel like AI scribes have been a positive tool to you?
Absolutely.
Absolutely.
And yeah, and the second thing I felt from the conversation, you think it's AI scribe will impact the future of healthcare and nursing
Mhm.
positively or negatively?
Positively, I think.
Yes, definitely.
Yes. Thank you so much. I had a wonderful conversation. I didn't know it saves 6 hours a day. That's a great amount of time.
It's
It is.
You
significant.
can,
You
I
know,
like
yeah, you can sleep 6 hours. You can go
it.
to the gym. You can nap. You can play with your kids. So
Yeah. When I say
thank you.
Ambience gave me my life back, it is true.
Yeah, especially with kids.
Yes. Yes.
Thank you, guys. And we'll see you maybe in the future with something new.
All right. Sounds
All right.
good.
For
Thank
now,
you.
have a good day.
Bye.
Bye-bye.
Bye.
Bye.